So guys, as you know that we've been seeing a lot of incidents coming up with low back pain and slip discs and back pain with the radiation to the leg. So this kind of problems are becoming now epidemic in India. In fact, all over the world it has become an epidemic, especially after the pandemic of COVID. And we are seeing a lot of younger populations getting affected. We see now patients even in their early 20s and early 30s, they are suffering from back pain with the slip disc and the sciatica. Obviously, these kind of patients who are not willing for surgeries, and even we don't want them to undergo a big major surgery and a fixation surgery. So what is the option for us? The best option what we have nowadays is the endoscopic discectomy, or it is called MISAP, minimally invasive spine endoscopic pain procedure. So with this procedure, we just have to give one small incision, just a 1/2 inch to 1 inch incision, and with that we can go with the endoscope and we can remove the disc material which has come out, which is compressing the nerve. And we can just decompress the nerve and the patient really gets relief within 1 day. We just have to admit the patient for 1 day, and these procedures are done under local anesthesia. So the chances of the nerve injuries are also very less, the complications are very less, and since it is just a 1 inch incision, there is no bone cutting, there is no implant which was put inside, so there is no like a delay in the recovery. Usually the patient goes back same day or the next day at IPSC. I'll show you this example. This is a very good example. I just did endoscopic procedure. Now you can see these are the disc over here. This is a spinal nerves which goes to our legs. So here it is fine, it is okay. Everything is fine here. But if you look at here, there's a big huge herniation, almost completely covering the entire spinal canal over here. And it is compressing severely this nerves. So this young girl, she is just 28 years old. She's a working woman. She has been on bed rest since last 2.5 months now. She's been suffering from back pain since last 2 years, but since last 2.5 years, it has started going to her legs. Now, for these conditions, such a big herniation, obviously, anybody would say that let's go for the surgery. Big surgery is required. No, it's not required. We just did this procedure. It just took 1.5 hours. Small incision, 1 inch incision, and the patient is back in her room. So these kind of conditions also now we can manage with the MISAP procedure, which is called minimally invasive endoscopic pain procedure. Thank you.